Good afternoon and welcome. This webinar is a collaboration between the United States Department of Veteran Affairs, VA Center for Faith-Based and Neighborhood Partnerships, CFBNP, and the VA Center for Minority Veterans. My name is True Luster Pauling. I am the Senior Outreach Specialist in CFBNP. I will be your moderator this afternoon. Everyone's phone has been muted. If you have a question during the presentation today, please type it in the Q&A box on the right of your screen. I will read the questions at the end of the presentation, and the presenter will provide a response. The presentation will be sent to everyone that registered and joined this webinar today. This is a live recording. I would like to thank our presenter for today, Ms. Carmen Drummond. We are grateful for your time today. But before we get started, I would like to introduce Mr. Conrad Washington, who serves as the Director for the VA Center for Faith-Based and Neighborhood Partnerships. Mr. Washington retired from the United States Marine Corps with 20 years of active duty service with a combat tour in 2004 in support of Operation Iraqi Freedom II. Mr. Washington is a licensed minister actively serving in his faith. He received his master's degree of Divinity in Pastoral Studies from Moody Theological Seminary. He also holds a MA in Business Management and a Bachelor of Science degree in Education. Additionally, he is a graduate of VA's class of 2017 Virtual Aspiring Leaders Program. Mr. Washington?
Thank you, True. I appreciate it. First, I want to say to all the attendees, we thank you for joining us. And hey, we had a great video for you from the secretary that Carmen, our presenter, provided for us. But for some reason, we had some technical difficulties. But please know we have over 60 webinars underneath our belt. So what we're going to do is we're going to post that video on our website so that you can have access to it. So just please know that as well. I want to thank you again for joining us and your patience. We're going to keep pushing here. I want to first also rather thank Carmen for joining us, for taking time out of her schedule to share this great information with you today. We know that in today's world, we have a lot of choices with webinars. It's kind of like a buffet. You know, which webinar do I want to go to? So we thank you for stopping by and getting information today as she presents regarding the National Hispanic Program in the Department of Veteran Affairs. We also want to recognize this month as the Suicide Prevention Month. And our office recently hosted suicide prevention and post-prevention webinar last week. Additionally, we will be sharing more information on suicide prevention as the weeks to come on our website, and you can sign up in our mailing list. I also want to recognize the upcoming observance of Rosh Hashanah, the Jewish New Year that begins on this Friday evening and ends this Sunday as well. With that being said, thank you all for joining, and I hope you enjoyed today's presentation.
Thank you, Mr. Washington. At this time, I would like to introduce Ms. Carmen Drummond. Please read her entire bio on the screen. Ms. Drummond currently serves as the National Minority Veterans Program Manager at the Center for Minority Veterans, U.S. Department of Veteran Affairs. She leads initiatives for minority veteran support, access, and benefits, leveraging her own experiences as an Army veteran. At this time, I give you our presenter for today, Ms. Carmen Drummond. Carmen?
Hello, good afternoon. Thank you so much, Ms. Pauling and Mr. Washington, for your introduction and really for allowing me the space to share with you all a personal journey, but also to highlight a program within VA that we're going to create some visibility for today. You'll get to learn a little bit more about me, and hopefully we will be able to connect after this and figure out ways that we can create innovation and just increase the way that we impact our veterans. So one thing that my bio does not mention is that I am an unapologetic Afro-Latina, okay? So we're coming into Hispanic Heritage Month. September is also Suicide Prevention Month. But I say unapologetic because I will not choose. I'm going to emphasize today the power of and not or. You know, being Afro-Latina means I have African, of course, and Black heritage. I was raised culturally as a Black female right here in PG County, Maryland. But my DNA and my customs and my traditions are Boricua from Puerto Rico. But that means I'm gonna cook a mean arroz con gandules and some collard greens. Okay, we're gonna play spades and dominoes, and I'm gonna beat you at both, and we're just gonna live our best lives. But it took a long time to get to this authenticity. And that's when I decided to choose and not or. And we'll get more into that. Next slide. Oh, me. Huh. I remember that from yesterday. All right. So here I am, Carmen Drummond on the right, and some very familiar person on the left. The person on the left, of course, is not the person on the right. And here's where I'm going to begin to share that story with you. So the person on the left, PFC Caban, went into the United States Army as a E3 in boot camp. So that means she was high speed before she got there, right? How many people go to boot camp as an E3? But going in, you know, she is a Latina and she was very ambitious. She was escaping a reality and really trying to create a life for herself. And I know she looks like a baby, but she had a young son at the time. In her tradition, her culture, how she was raised by her great-grandmother, her grandmother was to be a woman of distinction that sewed and had breakfast, lunch, and dinner ready around the clock for her husband to make sure that she was groomed all of the time, because that is what was handed down to them traditionally in their Latina culture. She was even gifted a book on cultures and traditions and how a Latina woman should conduct herself. Now, this young lady here, she was everything opposite of that. She was different. She was outspoken, unfiltered, in a way that really made her have to choose. And when she chose herself, and she joined the United States Army as a way to get out of her situation, to walk in her true authenticity, and to really own her own path and her own journey, even though she had been taught her whole life to do otherwise. So, at the age of 21, after she enlisted in a male-dominated industry, you know, the armed forces is male-dominated, she joined a male-dominated MOS, 25 Bravo, which is tech. We're seeing so many more people in tech now. But at that time, there weren't very many 25 Bravos, where people in tech that were in cybersecurity, that were in just tech as a whole, and were passing the classes. It was a really eye-opening experience for this young soldier. From experiencing biases from both peers and cadre, grappling with self-doubt, that imposter syndrome. Do I belong here? Am I gonna make it? One thing I didn't mention is that this young soldier was also married to a former service member, and that service member was battling PTSD. So at home, she was dealing with the struggles of post-transition of a service member, but also trying to find her way as a current service member and mother. Being constantly told that she was not good enough, that she did not do enough, she decided that she would live in the middle. Not too good, not too bad, but just enough so no one would bother her. Just so that she could fly under the radar and do her job, serve her country, and go home at the end of every day. Despite the conditions and the things that she faced through just battling through MST and harassment, and there are so many things that happened to this young soldier so early in her career, that she still stayed dedicated to the mission. she still stayed dedicated to the Army, because the Army she joined was not the Army that she was experiencing. She was smart enough at that point to understand that. She confronted as much as she could. She made sure that she documented everything, because she heard it was this agency called the VA, and they're going to want to know everything that happened. So she was going to have to keep really good notes if anything were to happen to her. Through her selfless service, she created many bonds of sisterhood and brotherhood that she still holds near and dear today. Through this, in her transition out of the military, she became homeless. She decided that she was not going to be a statistic. Homelessness did not have her. She had homelessness. It was a lived experience. It was an opportunity, just like the military, to gain perspective of another veteran. So her and her 2 children at that time made it out of homelessness because she buried her book in every VA policy, every VA program and service. And she got into vocational rehabilitation. She got her VA benefits. She did her own VA claim and was able to, due to her notes, was able to prove what was going on with her and what happened to her while in service. Her story had been used to testify on Capitol Hill for the Forever GI Bill, the Caregiver Act, and many other countless veteran initiatives and policies. She went on to join VSOs, tell her story, connect with veterans, and she learned about the power and transparency. This soldier separated from the military because she was given the choice to be a mother or a soldier. At that time, that soldier said, I want and. Why can't I do and? And came with the price of giving up her child. You can be a soldier and a mother without custody of your child. That wasn't good enough for her. So on March the 11th, 2011, she decided she was going to be a mother and a veteran. So after getting with all these VSOs and everything, she stands before many different positions before completely changing who she is. And today, PFC Caban no longer exists, but Carmen Drummond does. And that's me. My story was not easy. My journey was not easy, but I look at it as an opportunity to gain perspective so that I can understand where my veterans are. So that when I go to the table, although physically the perspective of another person may not be there, I have gained enough perspective to at least speak up so that when the next opportunity comes, that we add that chair. Through service, I wanted to be a lifer. I wanted to stay in the Army for my entire life. I just knew it. I even said, I'm going to go and finish up this degree, and I'm going to come back OCS, and I'm going to become an officer, and I'm going to find all those people and make them get down and do push-ups. That didn't happen. Right? I was so wrapped up in the transition. I was so enamored with the process and how many people ended up homeless. How many people were lost? Everybody wasn't resilient. Everybody didn't have the strength to step out of themselves and their situation to figure out a solution that would be beneficial for them and their families. So I decided that that's what my job was, and that's what I'm going to do. So now today I stand before you as the National Minority Veteran Program Manager at the Center for Minority Veterans, Office of the Secretary, where I oversee a program that spans across NCA, VHA, and VBA. There are coordinators across all 3 administrations. While their staff belong to those administrations, I keep up the operations. We make sure that each MVPC, Minority Veteran Program Coordinator, is a subject matter expert in the things that they do. So in addition to that, I'm also the Hispanic Veteran Liaison here at the Center for Minority Veterans, which means I'm the subject matter expert on Hispanic and Latino veteran needs. So I'm going to talk to you guys about here today. I keep on enhancing. All right, so I'm going to make this a little more happy. I know I may have brought you guys down and some of you are like, rough. That's rough. Everybody has a story. It's just how you tell it, when you tell it, and what the outcome is. My story doesn't have to be sad. It's not sad at all. It happened. Unfortunately, you know, sometimes it's part of our journey, but it did not own me. So the Center for Minority Veterans, we're the champions of minority veterans across the VA system. We ensure awareness, equitable access for benefit services that are earned by our veterans. They deserve all of the benefits that we have here to them, but unfortunately, sometimes our veterans don't feel that they deserve service. They don't deserve benefits, or they're okay where they are. You know, through our mission, we advise the Secretary on adoption and implementation of policies and programs that affect minority veterans. I don't know how many of you are familiar with Strong Act. That's one of the things that we're working on right now that we've been pioneering and really helping to shape and mold. We promote the use of VA benefits. We're really like internal superheroes and cheerleaders all at the same time, right? We're like, yay, 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 VA. And then we're also, hey, 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 VA. Hey guys, how can we get together to make this a better situation, or a great job on how we're outreaching to this group of veterans. We conduct and sponsor social demographic research. And then again, like I mentioned, Strong Act, making sure that we are in front of those laws and policies. And we make sure that all research and information is posted publicly, whether it's a collaboration between us and an administration or a program office. And we provide administrative services to the advisory committee on minority veterans. All right, so CMV is established by Public Law 103-446. We will be having a birthday here this November 2nd. We're almost what? We're old. We're pretty old. About to be 30 years old. But in 1994, the minority group member definition was Asian American, Black, Hispanic, Native American, Pacific Islander. That was the definition. We stand here before you today and we have added another layer, LGBTQ veterans. So we also have an LGBTQ veteran liaison who is here in the office to support those needs. We also support administration and SEC VA goals with special emphasis on Executive Order 13985 on advancing racial equity and support for underserved communities. All right. So I'm going to get to the more interesting stuff. That was just the regular policy stuff to let you know that this is not a touchy-feely program. This is not something that was created. We are a part of a public law. We do have congressional mandates that we must meet, and we do have someone to answer to at all times. So I wanted to make sure that everyone understood that and how we impact and connect with our veterans. Now, CMV has a group of liaisons. You'll see here to the very far left is our executive director, Mr. James Albino. Next to him is Mr. Ron Segudin, and he is our Asian Pacific Islander liaison. Paul McPherson is our staff assistant. Ms. DeAndrea Jacobs is my counterpart on Hispanic veteran liaison as a Hispanic veteran liaison. Ms. Ashley Carruthers is our LGBTQ liaison. Dwayne is our advisory committee POC, and he also was formerly the Black veteran liaison. Gregorio Kishkatan of the Kickapoo tribe of Oklahoma is the Native American veteran liaison. Then there's me, the second Hispanic veteran liaison. Wilma Morneau, who is one of our program analysts and serves to help us with data. And then Mr. John Warren, who is our national MVPC followed by at the very end, Ms. Deborah Walker, who is our Deputy Executive Director. And I say that to let you know that we don't only have a Hispanic Veteran Liaison or Hispanic Veteran Services. We have a liaison for each minority group that's identified by that Public Law 103-446, which also encompasses the Center for Women Veterans, where women are also a member of that minority group definition. All of us have a deep expertise and subject matter understanding of specific minority veteran needs within a community. If someone asks me something about a Hispanic veteran population, I should know. So I know that one of our top three things is access to language, Spanish literature, access to care. So a lot of our veterans live in rural areas, especially some of our Spanish-speaking veterans. And then the third is caregiver support. So I know that about the Hispanic population because it's my job, right? But also I have a deep passion and buy-in in the population to make sure that it is my business to know when trends change. It is my business to bring them up to our executive director and say, hey, these are some of the things that we're experiencing in the community. How can we create bridges to these barriers? We also engage with stakeholders, VSOs. I work alongside a lot of Hispanic veteran service organizations, a lot of HSIs, so Hispanic Serving Institutions. So this is HSI Week, where we're focusing on Hispanic serving institutions, colleges, and so on and so forth to make sure that we are connecting, but also bringing awareness and visibility. I'm sure for some of you never even knew that I existed, this program existed, the program office existed. And that's what these types of events are about, creating visibility, creating opportunity, and creating access. And without those things, we would not be here speaking today. Essentially, we also provide case management. I like to tell people, let's regroup. Let's look at this at a local level, because if it gets to me and I have to make a big deal about it, it's going to be everybody going to get in trouble, because everybody's on the block at that point, because we should have been able to figure it out at a local level. So we exercise chain of command. We emphasize that that is the appropriate way to go first. However, in addition to that, we make sure that we provide access and benefits to help our veterans with anything that they can do on their own. We like to teach them how to fish so that they'll eat for days and days and days, but sometimes we have a lot of veterans that need our support. In the last year, we've been able to help veterans recover from financial issues by I'm having a veteranism, guys. I'm having a veteran. Oh, somebody's at my door. But we provide all of our veterans with case management. So the veterans that we've been able to support as far as financial is if they've had community care and maybe somebody didn't sign a receipt or something, or we did not receive it. Optum, there was an issue with Optum or TriWest, and we tried to help navigate so that those veterans don't start to experience collections. They don't experience financial burden, which can be very detrimental to a lot of veterans, to their health care, to the way their livelihood, because now they're stressing over something that essentially, did not belong to them if it was VA authorized. So that's just one situation that we've been able to help in the last year. All right. So I told you guys I'm the National Minority Veteran Program Manager. See, is this Q&A on? Yes. Okay. So I'm going to go, before we get into the Minority Veteran Program, I'm going to go over these questions just a little bit. But also I'm going to ask for a little bit of interaction. So if you've ever heard of the Center for Minority Veterans, I want you to say I have, or yes, I've heard of CMV, or CMV is the best, something to that effect, so that I know you have. If you have not, and say, I learned something new today. Today is my first time hearing about your program. All right. And it says, how would I go about collaborating with CMV for virtual sessions for our local NAACP and veteran members here in El Paso? You can send an email to minorityveteranprogram@va.gov, and I can connect you with your local MVPC, whether it be a VBA, VHA, or NCA, or all three. And then we can coordinate a way for you to have a local event for your local chapter. And thank you for your kind words, Val. I appreciate that. Thank you so much. Okay, it looks like we are good. Okay, Carl, I'm with you. CMV is all that in a bag of chips with a soda on the side. All right. All right, so as we go on, I mentioned earlier that in addition to being the Hispanic Veteran Liaison, I'm also the Minority Veteran Program Manager. And through that, I cover all three administrations with MVPCs that span across the country. And each MVPC has a unique catchment area. Some may be very heavy in tribal nations. Some may be very heavy in Latino, Hispanic. Some may be very heavy in Asian Pacific, Pacific Islanders. So we want to make sure that we are preparing our MVPCs for what they need to be successful. I'm going to close this chat because that's distracting me. All right, so the Minority Veteran Program. It is overseen by Mr. James Albino, and then I am the Minority Veteran Program Manager. And I just wanted to give you a visual on how we're kind of built out. Everyone that's in blue works for the Center for Minority Veterans. Everyone that's in gold is appointed to the program by their administration. So we have an NCA program analyst, we have a VBA program analyst, we have a VHA program analyst, and they work with a appointed administration liaison. So that means that each administration has says that this person is dedicated to being your liaison to your program analyst to make sure that for the entire administration, they work collaboratively to create better solutions for our minority veterans in those catchment areas. Okay. Each facility director appoints an MVPC. Okay, some MVPCs are collaterals, some MVPCs are full-time employees. It doesn't always end up the same that, you have two full-time MVPCs. Sometimes we have an alternate that's full-time and, a primary that's full-time and an alternate that is not, and they're collateral. So when we're reaching out, I will ask grace for our MVPCs because a lot of them are still in collateral roles, but we are utilizing that Minority Veteran Program at va.gov as a great way for us to flesh out and assign tasks as needed. All right, so our program coordinators, they serve as CMV's local liaisons and advocates on issues pertaining to minority veterans in their catchment area. I just kind of went over that before this. But also they conduct targeted outreach to educate veterans on VA benefits. So an event, let's say they're going to a powwow somewhere in Albuquerque, or they're attending some sort of festival where they're going to be veterans, or let's say they need to make sure that they're reaching out to community partners like the NAACP they need to connect with those individuals to make sure that they're creating awareness for the program, but also, like the request said in the Q&A, to create events at a local level so that they can be engaged and provide the best access to our veterans. They collaborate with other MVPCs, so you'll often see inter-administration collaboration. I preach to our MVPCs two things: collaboration and intentional outreach. Collaboration, it starts with, health benefits and cemetery burial benefits. They all work hand in hand. Unfortunately, our veterans start at one point, either healthcare or VBA or VHA, and a lot of times end up with the family reaching out to NCA for support for burial or for any type of terminal support for a veteran. So we try to work collaboratively so that we are educating everyone on whether it's life insurance or ACT. We want to make sure that our veterans have access to that. I often like to say our minority populations, a lot of times, either because of, let's say, our Hispanic population, the language sometimes isn't there for them. And not that they don't speak English, but Spanish might be their first language. So comprehension is a little better, or their caregiver only speaks Spanish. We have issues where we're not able to provide the awareness and the access. So I like to say our MVPCs and CMV, we are the invitation to the party. We often get it too late, not on time. We don't understand what's going on. And we're the invitation. We are that person that comes in and says, let me meet you where you are. Let's get this for you in a language you understand, whether it's Tagalog, whether it's Spanish or French or German or whatever it is. Let's get you access, okay? We're also abreast of VA programs, although a lot of times we get new program offices. We really try our best to stay on top of what's going on and creating POCs and those relationships within the interagency ecosystem. We meet quarterly with facility directors and VACO leadership. So everything is very transparent. We know how many minority veterans are in a population, how many were reached, and what works and what doesn't work for this population. And it really helps us with creating better synergy with our MVPCs. My favorite part for our program coordinators, and sometimes I think I'm a program coordinator, even though I'm the national program manager, I like to be the local program coordinator sometimes because they get to advocate on behalf of minority veterans. That's where that superhero cape comes on. That's where the heart, the passion, I know you hear my voice, the heart, the passion, the ambition, all of that comes there. And they get to advocate for the veteran. They get to make recommendations to improve service delivery with their facilities. And that part right there, it really takes a big amount of courage and self-assurance and commitment, because unlike a lot of other special emphasis programs, we do have that ability to speak up when things happen. We do have the opportunity to say, hey, this isn't working. Can we create another way to make this work? Or this is working. Can we take this and duplicate it in areas that are like yours? All right. So our MVPCs also provide those quarterly reports. So that's where a lot of our data comes from. So over the last year, I'm proud to announce that we have increased minority veteran engagement by 50%. So that has been a very big accomplishment for us. We've become more intentional, and that was just through listening to our veterans. And the biggest thing was from our Hispanic population wanting Spanish literature, wanting Spanish speaking individuals. We collaborated with the Veterans Administration Hispanic Association, that's what it is, BAHA, and they provide us with Spanish speaking services. So if I have an event that I need to run in English and Spanish, I will utilize our counterparts to make sure that we do have it available in Spanish as well. Not only just for comprehension and translation, but also for that familiarity, right? That connection. A lot of times you need something that's familiar to you to keep you connected to a mission. And if, you know, having our Spanish speaking employees and staff members and collaborative programs do that, then that's what we will do every single time. All right. All right. And I mentioned intentional outreach. And here are just some examples of intentional outreach. You know, we've gone to Gathering of the Nations. We've put on LGBTQ Pact events. I did an event with Ms. Pauling where we were at First Baptist Church at Glenarden. And that was a great opportunity for us to connect because we tapped into underserved population that wanted our services and needed our services. And we were at about 60% of the people who were there were able to get access to their benefits on the spot. Everyone else, either a very small population, maybe about 8% of them had to return or make appointments for another time. But everyone else, they started VA claims right there on the spot. And they were able to sign in, create intent to files. So it was a great opportunity for us to reach that population. We're also part of the White House Hispanic Initiative Interagency Working Group. I'm the PLC for that group, and we work collaboratively across all agencies within the federal government, and we share resources, what works, what doesn't work. We guest speak at each other's events, but also we have inclusive events. So, you know, if OPM is having a hiring event and they let us know, we can either have a part in it to help send veterans their way or to just get the word out. We have the Women's Veterans Appreciation Brunch in coordination with Heroes at Night, and that was a local event. And all of these things, and the reason why I'm bringing these up to you is because they're all unique in their own right, but they're intentional. We knew that we needed to reach out to certain populations because in certain states they were hurting. We were not reaching those veterans. So we had to make sure that we made attempts and continue to reach out so that we could build trust, so that we can ensure that our veterans know that this is not just a one-time thing. This is a we are here thing. I'm always going to be here. CMB is going to be here. VA will be here. And we will continue to fight to show our veterans that we are going to continue to provide access. We are going to continue to show up every single time. So just through intentional outreach, we've been able to increase that population percentage by 50%. So I mentioned Spanish literature and things like that. So here on the left, it may be a little hard for you to see. Here on the left, you'll see it here in English. And this is our MVPC pamphlet. It's in English and Spanish. In Spanish to the right is a little hazy. Sorry about that, but I can get it out to you all. It's very cool to see my quote in Spanish, more so because yo soy boricua, pero mi español is not very good looking. And so it gives me an opportunity to practice, but also it gives me connection to my veterans because I know what it says because I said it, but also it helps to build trust and familiarity and tradition. And it shows that we care about the culture and the people that we serve who are a part of those cultures. All right, let me take questions. I'll leave you guys here like this. I'm gonna look at questions. In the meantime, we do have 5 events. Literally before I started this one, I ended my hosting with the first Hispanic Heritage Month event at 11 o'clock today, but the next event will be on September 21st. I will not be hosting, however, I will be there. So if you guys could, please reach out. You can send us an email at minorityveteranprogram@va.gov, or you can go to va.gov/Center for Minority Veterans, and it's on another slide after this. So you'll have an opportunity to check it and subscribe to our mailing list. And I will send out Gov delivery requests for event registration through that system. And you'll be able to engage and connect with us. So every time we have an event, you will get it. Every time something new happens, you will know. And every time that there is a new service or a benefit that we're pushing or we know about, you will also know. So I'm gonna continue. I'm gonna check these questions and then I'll go to.
Thank you, Ms. Carmen, so much for your presentation. We're so thankful for everything today. We do have some questions in the Q&A box, and for the folks out on the phone, we are going to read that person's name out loud and then cite their question so everyone can have opportunity to hear your response. Our first question is coming from Mr. Carl Dyer. I heard you say something about this question, but I'm not sure if you answered it or not. This question was, how would I go about collaborating with the Center for Minority Veterans for a virtual session for our local NAACP and veteran members here in El Paso?
So you would send, and please excuse me for reading ahead and multitasking on the question.
Right.
So you would reach out to Minority Veteran Program at va.gov, or VACO, VACO, CMV at va.gov. But you would reach out to us and say, I would like to have an event in my local area, with the Minority Veteran Program or CMV, whatever your request is in your wish list, and then we'll get you connected with someone that can support that event.
Okay, great. And I believe there was another question, and I believe it was answered already. Mr. Luberta Knowles had a question about, he said he was an investor in Gary, Indiana, and had rental homes available for veterans. How do I get connected or sign up to have veterans clients for my properties?
That sounds like maybe like a HUD-VASH question, but if you send me that email, I can try and find you a POC to see if that's even something that we can support at this time. But please send me an email to any of those email addresses that were listed, and I will do our best to get you in contact with someone.
Okay, thank you so much, Carmen, for that. Okay, scrolling down here. There's a question from Mr. J. McLeonard, and he says, are there funds allocated to reach the non-federally recognized Native American tribes?
So we provide support to all Native American tribes. However, for non-federally recognized tribes, there aren't per se any funds that are available for that. However, we continue to provide outreach and engagement through Strong Act and other VA outlets and policies to make sure that we are reaching the Native American Alaskan Native population.
Okay, thank you so much. We do have numerous comments that we will provide to you. And we want to say to our audience, if you have any more questions for Ms. Drummond, please feel free to reach out to her directly. You can see her point of contact information on the screen here. Also, we will have our team email addresses and point of contact on the screen as well. We will provide her, we have all of your email addresses, so we will be able to get back to you directly. At this time, I will turn the mic over to Mr. Washington for closing remarks.
Thank you, True. Hey, Carmen, we appreciate your great information to the audience. I'm sure it's very helpful based on the questions, and we'll get that to you if we have additional questions. And also, as a reminder to the audience, we thank you today for joining us. The video that we wanted to play will be posted on our website. So please go there. We have all of our webinars since 2020 on there. I'm going to put that video there. And Carmen, we appreciate you. So all of you have a great rest of your week and take care.
If you registered for this event, we will provide you with today's presentation. Please subscribe to our website and Facebook for future webinars. Thank you so much for joining us today. This adjourns today's webinar. Thank you and have a safe and wonderful day. Goodbye.